Okay, this is from the book Preventative Reverse Parkinson's Disease and Chronic Fatigue Syndrome by me, Pete Rogers, page 277. We're going to be talking about why microglia eat brain cells. So microglia are the immune cells in the brain. They're the security guards, the bodyguards of the brain. Okay, and what happens is when a brain cell gets low in energy, they eat it. And the reason they eat it, called phagocytosis, is because they want to remove it before it bursts. If it bursts, its internal contents spill out into the extracellular space, and all these sort of immune privileged chemicals will be exposed to the immune system, and it will trigger a massive inflammatory reaction. By the brain eating the cells before they burst, it can clear them out and prevent a big inflammatory reaction. So you end up with just apoptosis. When this is looked at under a microscope by a pathologist, all you see is a shrunken brain. And the reason why this is so important is there's lots of things that cause the microglia to eat people's brain cells. And I see this all day long every day. I look at many thousands of brains, and I can tell you I've lost count many thousands ago. Cognitive decline, memory loss, dementia, okay? And what I see almost always, I don't see so-called Alzheimer's, parietal temporal focal atrophy. I see diffuse atrophy all day long, every day. Okay, so now I'm going to explain to you why it happens, because by understanding what causes it, you can more easily prevent it. And this is preventable easily most of the time. Okay, so here is M0 is a microglia, which is a type of macrophage in the brain, the immune cell of the brain. When it's resting, it'll have these long, extended, like pseudopodia sticking out from itself. Looks like a starfish, okay? Once it's primed, that's almost like a security guard on high alert, that he's worried about something, but he's not yet doing anything, okay? So he's taking the safety off, okay, but he's not about to do anything, all right? When he's fully activated, so whatever the potential threat is, it increases, then the microglia is fully activated, it'll start eating brain cells, okay? What are things that activate microglia? Excessive psychological stress. So people can lose brain cells from excessive psychological stress. Excessive cortisol from excessive psychological stress, from excessive caffeine ingestion or other stimulants like cocaine, amphetamines, sleep deprivation. If there's a lot of inflammation around the brain with elevated tumor necrosis factor alpha, bacterial endotoxins like LPS, lipopolysaccharides. So if you've got leaky gut, whenever there's leaky gut, increased intestinal permeability, there's going to be increased blood-brain barrier permeability, and these bacterial endotoxins from the gut will travel through the blood and go up to the brain, get across the blood-brain barrier permeability, and they'll irritate the outer surface of the brain. Okay, that's another reason why high-fat diets make people stupid. So that can activate microglia. If there's trauma to the brain, traumatic brain injury. So this is why somebody with a concussion should be on prolonged leave from a sport, not just, sit out this quarter or sit out a day or something. You need prolonged rest to heal that blood-brain barrier, and they should also eat a high-fiber diet to help reestablish both the gut barrier and the blood-brain barrier, which simultaneously are damaged by head trauma. Chemicals like atrazine, the typical estrogenic chemical sprayed on corn, okay? Chronic opioid use, exposure to inhalation of diesel fuels, inhalation of paints, VOCs, volatile organic chemicals, smoking tobacco. All of those things will activate microglia. Okay, the activated microglia, they're going to have pattern recognition receptors for PAMPs and DAMPs. So PAMPs are pathogen-associated molecular patterns. DAMPs are damage-associated molecular patterns. That means to remove pathogens and to remove damaged tissue. So the LPS, bacterial endotoxin, will activate, the PAMPs, pathogen-associated molecular patterns. Okay, you could call it MAMPs, microbial-associated molecular patterns, okay, or bacterial-associated molecular patterns, okay, and it will clear out the cells, all right. Now M2 is sort of is going back into being resting, sort of a positive, helpful microglia in the brain, okay. Now I'm going to show you more about how does the brain know, because that's the other question. How does the brain know when it's time to eat a brain cell? Okay, so first of all, let's look at what happens in a normal brain cell. In a normal brain cell, you have asymmetry of the inner and outer leaflet of the phospholipid bilayer. All cells have a phospholipid bilayer on their outer surface. It's called the plasma membrane of a cell. So the circular part is the phosphate component, and then the two little tails are the fatty acid tails. All right. The most important thing in this whole picture here is the letters PS. PS stands for phosphatidylserine. That's a type of phospholipid. Under normal conditions, you have an enzyme called flippase, and flippase keeps the phosphatidylserines flipped into the inner leaflet of the plasma membrane. There's other phospholipids that are also kept in a positional basis under asymmetry, okay, but we don't really care about those. The only one we care about is phosphatidylserine, just to keep this simple. Floppase is the enzyme that flips phosphatidylcholine to the outer layer. Okay, great, fine. Now here's what happens. If the cell runs low on ATP, remember you need ATP to keep flippase working, to keep phosphatidylserine on the inner leaflet. If you run low on ATP, then it'll start flipping into the outer leaflet, phosphatidylserine, and these complement binding proteins will bind to the phosphatidylserine, and those are like a neon eat me sign, eat me, eat me, eat me. And this is the big monster microglia coming in, and it'll eat the neuron, and it'll remove your brain cell. And this happens day after day for a couple decades. You become stupid, okay? And for most Americans, this is happening day after day for decades, okay? Because they got all these bad habits. They're stressed out, they're sleep deprived, they drink coffee, caffeine, and tea every day. They ingest excitotoxins, things like glyphosate, things like aspartame. They have elevated beta amyloid protein because they're insulin resistant because they eat a high-fat diet, for example. Okay, their mitochondria are inhibited by fluoride, by aluminum in their tap water, in the processed food, the glyphosate, the atrazine. All these things are contributing. Okay, so anyways, this is why a cell gets eaten. When it is low in energy, the microglia eats it. So one of the things you're probably thinking is, isn't that weird that the brain would eat its own cells? Again, it does that to protect from the greater evil of the cell bursting. The next question is, why does it use phosphatidylserine externalization to choose what cells to eat? And the reason is because this provides an exact, precise target. If the cell were to release a chemotaxis factor, like a chemical that would diffuse into the extracellular space, the brain cells are so crowded, there's over like 100 billion neurons in your brain with 10 times as many supporting cells, it would diffuse all over the place and the microglia wouldn't know what cell to eat. But because it's from the actual plasma membrane of the ATP depleted cell, it'll eat it. Okay, that way it can exactly bind to it and only remove the cell that needs to be removed. But the bottom line with this is you don't want your brain cells low in energy. And this is another reason why you want to avoid these mitochondria inhibitors. And they're super common. Okay. So here is now showing some more of the things that will cause these cells to become deficient in energy and get eaten. If you got SERCA inhibitors, SERCA is sarcoplasm, endoplasmic reticulum, calcium ATPase. It's really the endoplasmic reticulum normally functioning as a calcium reservoir. So cytoplasmic calcium can be pumped into the endoplasmic reticulum. That's an ATP-dependent process. If you inhibit that, then you'll get accumulation of calcium in the cell. It overactivates the cell, so that has an excitotoxin effect. That means excitotoxin means overstimulation. It means the cell can be overstimulated to death, whereby its metabolic rate goes too high relative to its oxygen, glucose delivery, and its ATP production. Those are the three things that matter. And this gap gets too wide between energy production capacity and energy needs. Boom. Cell drops in ATP, microglia eats it. Dead cell. Okay. I see all these shrunken brains, nonstop shrunken brains all the time, every day. I see an endless parade of shrunken brains because all the patients have the same diseases. They've got hypertension and diabetes, causing atherosclerosis, plugging up the arteries in their brain, causing a lack of oxygen delivery to their brain cells, and then on top of it, caffeine, sleep deprivation, and stress. These neurons become low in ATP energy. Microglia comes in and takes them out. Okay. So some other things that'll do it. Mitochondrial inhibitors, we talked about that. I found over 120 of them. I've got them listed in my other lectures. I have a list of all of them in this book, and a lot of them are real common. Tylenol, atrazine, fluoride, aluminum, mercury, cadmium, beta blockers, selective serotonin reuptake inhibitors, metformin, statins. They're common. Propofol, most antibiotics, beta-lactams, fluoroquinolones, aminoglycosides. Okay. All right, what are some of the other ones? Hypoperfusion, hypoglycemia, hypoxia, intracranial atherosclerosis from hypertension and diabetes. Anything that puts you high in calcium, all your excitotoxins will lead to the same process too, because they have the same net result. Activation of the no pathway, excess EMF. All right, so here's another scenario. This is what happens from high-fat diets. You eat a high-fat diet, you get insulin resistance. When you get insulin resistance, that means your blood insulin levels, your pancreas pushes out more insulin in the blood, so you get higher insulin levels. Now what happens is the insulin degrading enzyme has to remove the insulin from the blood. But insulin degrading enzyme is only made in fixed amounts, so if there's a shortage of insulin degrading enzyme, you don't have enough of it to clear out the insulin. And it has a much higher affinity for the insulin than it does for the beta amyloid protein. So when you have hyperinsulinemia, high insulin levels, your insulin degrading enzyme gets used up with the insulin clearance, and it's not available to clear out the beta amyloid in the peripheral circulation. Peripheral means outside the brain. So the beta amyloid will travel through the blood to the brain, and it'll get across the blood-brain barrier. It goes into the brain, and it activates the NMDA receptor. So it's an excitotoxin. It also activates the microglia, gets them excited, and they start doing more aggressive things to damage brain cells. So this is another reason why high-fat diets make people stupid. You want to know this because you can make a mouse stupid real fast by feeding it high-fat diets. And humans eating these high-fat diets, I'm telling you, most of the people I see over 60 are mentally slow. Okay, I'm 63, my brain's fast. I always laugh when I talk to medical students. I say, my brain's faster than yours and you're 25 years old. You better not eat these high-fat diets, okay? Okay, traumatic brain injury increases that. You also get activation of the no-oh-no pathway. The no-oh-no pathway causes a lot of brain damage too. Alcohol, all this stuff, tobacco. All right, this is just showing you what happens with leaky gut. When you have leaky gut, you have which means increased intestinal permeability. Bacterial endotoxins get across the gut wall. LPS from gram-negative bacteria, LTA from gram-positive bacteria. LPS means lipopolysaccharide. LTA means lipoteichoic acid. They will travel through the blood to the brain. Whenever you have leaky gut, you're going to have leaky blood-brain barrier. So they'll get some access to the periphery of the brain. They both will bind the pattern recognition receptors, okay, for PAMPs on a microglia, brain guard cell, security guard, and it will then become activated, start releasing toxic chemicals that will damage adjacent brain cells, okay? And some of these adjacent brain cells, when they're damaged, they'll drop their energy production. Now they're going to become ATP deficient. Phosphatidylserine flips to the outer level. Microglia comes in, eats the brain cell. Bye-bye brain cells. So, you got 100 billion brain cells, that's a lot, so you do have some reserve. But you keep doing this day after day, as most people do for a couple of decades, eating high-fat foods, and you'll have destroyed so many brain cells, you'll have this drop in cognitive function. I see all these old people, they're walking real slow, they're real frail, they're real mentally slow. They're still pleasant. They can say hi, they somehow manage to travel a little bit. They can still drive just barely, but man, are they slow and stupid. They're pretty helpless, okay? And they often have really bad outcomes. Okay, I'm going to talk a little bit about quinolinate, which is an excitotoxin as well. Let's see here. First of all, here's a bunch of things that activate microglia. So all of these things can potentially cause brain damage when they're present in excess. Chronic psychological stress. Everybody has stress in life, but when it's chronic sleep deprivation, chronic corticosteroid medications, chronic ingestion of caffeine, okay? When you're 30 years old, you get away with it, but the older you get, the less your body tolerates the caffeine. Methamphetamines. You've seen how terrible people look after taking those things. Cocaine, methylphenidate. Chronic massive obesity, aging, excessive glutamate, excessive dietary zinc. I talked about the beta amyloid proteins being elevated. Leaky gut, we talked about that. Atrazine, the herbicide sprayed on corn, and some other things, lawns, maybe golf courses. Chronic exposure to toxic fumes like diesel exhaust, air fresheners, scented chemicals, paint, cooking smoke, volatile organic chemicals. If you're going to cook and there's smoke, you want a hood, okay? Brain surgery activates microglia. Ischemia activates microglia. Lack of oxygen, inflammatory cytokines for whatever the reason. You see some of these people after pneumonia crash and burn because of the inflammatory cytokines overactivating their brains. Inhaled aluminum. You don't want to use deodorant with aluminum. Mercury activates the microglia. That can in part be from amalgams going through the bidirectional veins between your jawbones, your mandible and your maxilla and your brain. They're valveless veins. Brain infection, alcohol, chronic opioids. Okay, and some excitotoxins. This guy, Jared Younger, a real smart guy over at University of Alabama, he says if you want to save your brain, you got to turn off your microglia. Excitotoxins are things that just increase calcium in the cytoplasm, or a lot of times increased permeability of the NMDA receptor, like stress because it increases glutamate transmission, caffeine because it increases glutamate transmission. Ryanodine calcium channels on the endoplasmic reticulum are also opened up by caffeine, so that's double bad. Caffeine's a total screw job for the brain. It drops oxygen and glucose blood flow to the brain by about 20%, while it's simultaneously wrapping up the metabolic rate of the neurons. That's double bad. MSG, monosodium glutamate, manufactured free glutamate, those are brain toxins, aspartame, brain toxins. These are all excitotoxins, meaning that they overstimulate brain cells. They're stimulants. Glyphosate, sprayed on the non-organic food, because the NMDA receptor is a coincident detector, and it also detects glycine. That's glycine phosphate in a sense, so it activates it. Quinolinate is a product of the kynurenine pathway. Kine means dog, urenic means urine. So dog urine is where they discovered this stuff. Okay, and it comes from eating the amino acid tryptophan. When somebody's stressed out and the microglia are activated, it shunts the tryptophan into making quinolinate. I'll show you a picture of that. So here's the pathway, and you're starting out with tryptophan as amino acid. Normally, that's a good amount of that should be made into serotonin, and some of it's made into melatonin, and that's all good. Okay, some of it goes to protein synthesis. That's good. But when you have excessive psychological stress and activation of the microglia, large amounts of the tryptophan get made into this quinolinate, the stimulant, and it'll then activate the NMDA receptors here and have an excitotoxic effect. So that's just part of the mechanism for excitotoxic effect. So anyways, all of these things that are depleting the neurons of energy so they can't maintain phosphatidylserine in the inner leaflet are things that cause the neurons to be eaten. When a brain cell is eaten by a microglia cell, immune system cell, it then disappears. It's called apoptosis, programmed cell death, where it disappears clean without a trace. Under a microscope, all you can see is a relatively paucity, a decreased number than expected of brain cells. And this is how most brain cells are removed. So you don't want this. And it's easy. How do you avoid this? Number one, avoid the mitochondrial inhibitor. Filter your tap water, eat organic only, eat unprocessed, whole foods, single ingredient only. Don't eat anything with MSG or MFG in it. Don't drink caffeine. Don't take stimulants. Get your sleep. Manage your stress. Filter your tap water with reverse osmosis. Only take medicines you absolutely have to take. Don't just take them for the heck of it, especially if they simultaneously have the side effect of being a mitochondrial inhibitor. Avoid anything that smells bad. Most things that smell bad end up being SERCA inhibitors. Avoid high-fat diets because they end up causing insulin resistance. And whatever elevates your hemoglobin A1C also causes some inhibition of SERCA in general. Strongly correlated between elevated hemoglobin A1C and decreased SERCA function in your neurons, meaning inability to clear calcium from the cytoplasm because you can't pump it into the endoplasmic reticulum. So it's bad. So, use your brain. You have a nose. God gave it to you for a reason so you can smell stuff. If something smells bad, be concerned that could be a SERCA inhibitor and avoid the thing. So anyways, that's pretty much it. That's why microglia, brain immune cells, macrophages, guard cells of the brain, will eat brain cells because they're clearing them out before they fully die and burst, which would cause bigger collateral damage. And this is how most brains are shrunken, destroyed, become atrophic, and demented.